I have in my PPE, this is a motor vehicle accident, so I have gloves, glasses, helmet and vest. So what we're doing is we've just run through a rapid trauma assessment and we found the life-threatening injury of the patient's pelvis is unstable. So now what we're going to do is we're going to run through a secondary survey and identify any disfiguring injuries or anything like that, and being careful not to reassess that pelvis. So we're starting at the head and moving down, and we're checking for any boggy masses or anything like that. We're also checking the ears for cerebrospinal fluid, and we're checking the eyes for signs of a base of skull fracture presenting with raccoon eyes. Someone is stabilising the neck while I run through this. So just moving my hand down the patient's neck, can't find any abnormalities, and also checking the front of the patient's neck, and I can't see any signs of tracheal deviation or JVD indicating tension pneumothorax or cardiac tamponade. So what we're going to do is, now that I've done that and moved over, we've put a spinal collar on the patient. So now moving down to the chest, and I'm going to palpate across the chest, checking for subcutaneous emphysema or anything like that, and also going to bilaterally spring the chest, checking for if there's a paradoxical movement going on, and also going to auscultate the patient's lung fields. We're going to do this in 4 spots on the front. Okay. Okay, so patient has bilateral air entry, and so I'm just going to palpate more across this chest, see if I can find any evidence of decap BCLS or anything out of the ordinary. I'm also going to percuss the chest in multiple spots, and if there is hyperresonance, I could be looking at tension pneumothorax, and I'd also listen to some heart sounds. And if there's any dull heart sounds, that could be a sign of cardiac tamponade. Okay, so no dull heart sounds. So now moving on to the abdomen, I'm going to palpate the 4 quadrants. And also looking for any tenderness, rigidity, guarding, any signs of that, which I can see some guarding lower down in the abdomen, so I'm going to leave that alone. I'm also going to leave alone the pelvis, which has the pelvic binder on, and I'm going to move down the legs, looking for any deformities, contusions, abrasions, lacerations, going down, looking for any distracting injuries, can't find anything like that, going down both legs. I'm also then going to check the pulse, the pedal pulse. I'm going to check the motor response, which the patient is unconscious and cannot provide a motor response. But everything looks fine. Foot moves to sensory stimulation. And then now moving to the arm, feeling down the arm, nothing out of the ordinary. And I'm going to perform a capillary refill check. Cap refill is about 2 seconds. Okay, so now that we have done with the secondary survey, what we're going to do is going to rapidly extricate this patient and make sure that we're monitoring vitals every 5 minutes and seeing how we go.